Kate Watt from Susan G. Komen South Florida and Dr. Elena Rehl, a breast surgeon at Good Samaritan Medical Center, are here with us today. Nice to see you. It's almost been a year.
Nice to see you.
A lot of changes, a lot of successes since the last time you were here.
We've had a lot of changes. As you know, we moved from a regional organization to Komen, Florida, and we were very proud to be headquartered here in Palm Beach County at Good Samaritan Hospital. We launched a community breast health navigator program now almost 2 years ago that has helped hundreds of women navigate the healthcare continuum and get to the care that they need. This year we're launching an advocacy program and taking our mission to Tallahassee to help all Floridians get greater access to healthcare and to breast healthcare. And of course, we're still out there, here in our community, making sure that women and men have access to screenings, diagnostic services, and treatment that they need in the fight against breast cancer.
Metastatic breast cancer, you guys are really taking a big focus on that this year.
Absolutely. We just announced $26 million in grant funding as Susan G. Komen, and most of that is dedicated to our most aggressive forms of cancer, breast cancer, and 38 of those grants went to metastatic breast cancer research. So really looking at how we can develop new treatments and therapies and find a cure for breast cancer.
Dr. Rehl, let's bring you into the conversation. When you hear this particular form of breast cancer, Kate mentioned it's very aggressive. What's the latest on it and even treatment options at this point?
So, Holly, the thing is, breast cancer is such a common disease, and in this country this year, over 200,000 women will be diagnosed, and for the most part, it's treatable and curable, but there's still 40,000 women that will die of the disease this year. And so metastatic breast cancer, which is the most serious type of breast cancer, which is when the breast cancer has left the breast, spreading either through the bloodstream or the lymphatics to other organs in the body, the liver, the bones, the lung, and this is when it is no longer curable but still treatable. And there's many, because breast cancer is so common, there are many different modalities to treat it and a lot of new research to find better ways to treat metastatic disease. So the key thing is there's hope with many of these new treatments.
Advocacy has to play a major role here too.
Absolutely. There's 154,000 people living with metastatic breast cancer in our country right now, and they need access to treatment as early as they can get it. So reducing step therapy practices to make sure that they can get connected to the therapies and the medications that they need without having to fail first is one of the things that we're looking at. And certainly, making sure that they have access to health care is another issue for us. So we're battling that on the federal level, and we're working right here in the state of Florida with fantastic legislators to make that happen right here in our state, and we're really proud of the work that's being done.
Absolutely. Give me the website for you all, Komen.
KomenFlorida.org.
Such a great resource tool for people to have. All right, we want to encourage our viewers there to go to that website and learn much more. Thank you all. So much valuable information. I know we'll be seeing much more of you throughout the month of October as well. Thank you.
Thank you, Holly.
All right, let's go ahead and go to break. We'll be right back with this.